So I feel like I'm a little bit late to the game. I only heard about ChatGPT about 2 weeks ago, but over the past 2 weeks, I've been deep diving in all the content I could learn about ChatGPT. And after 2 weeks of working with ChatGPT and looking at it and thinking about how it's going to affect and disrupt healthcare, and in particular, I've been thinking about it from a mental health perspective, how it's going to affect the mental health of people and the service provisions for people who have mental health issues. And I guess all I can say is I'm a bit flabbergasted, like, speechless. It's going to affect healthcare. It's going to disrupt healthcare significantly. I think it's important to say from the get-go that I'm an optimist. I think jobs will change as a result of this, and they already are. There's already a lot of programming jobs that are being made redundant because ChatGPT can do a lot of those jobs. And the same thing will happen in healthcare as well, but hopefully it will augment our capabilities and we'll be using it as a tool to deliver better quality service. So in this video, we're going to talk a bit about how it affects the students, like mental health students, people going to universities. We're going to talk about how it affects professionals. I myself am a junior doctor. I'm a registrar in mental health. So I'm on the psychiatry training program, training to become a psychiatrist. So that's a medical doctor that works with mental health patients, schizophrenia, bipolar, depression, all sorts of things. So I can talk about how it's going to affect that. And finally, we'll also talk about how ChatGPT can help patients. So yeah, it'll be broken down into those three categories: students, professionals, and patients. So let's get into it. So let's start by explaining what ChatGPT is. ChatGPT is a neural network, which is a machine learning algorithm, which is an artificial intelligence algorithm, where it essentially, you give it a data set, you give it a set of inputs, and because of the way the algorithm is organized, it's basically modeled after the brain, and there's different neurons and they're weighted differently, and then they activate other neurons and the biases will change and they will activate or not activate, and it'll result in an output. And a great way to find out what ChatGPT is to ask it. So when you go to chat.openai.com, you'll be presented with this. You have to set up an account and stuff, and it's an incredibly powerful thing. You say, explain ChatGPT in 2 sentences. ChatGPT is a neural network-based language model that can generate human-like text. It is trained on a large data set of conversational text, allowing it to respond to prompts in a conversational manner. Okay, so it's a machine learning algorithm that has been based off all this data till 2021, and it's revolutionary because it can kind of remember what it has said to you and it keeps context. So how does this relate to mental health? So we talked about how is it going to affect students, so therapy students going to university, or psychology students or counseling students. Essentially the fundamental thing that's obvious so far is that it's completely made essay style homework redundant. This is an incredibly powerful tool to do essays because it's so linguistically intelligent. So for example, I'm, as a medical student, if I say, write me a 1,500 word essay about about antipsychotics and their use in the treatment of schizophrenia. So this is an essay that maybe a first or second year medical student would have to write, and it would take maybe 3 or 4 nights. In real time, what we're seeing is it's generating an essay. It's not looking at previous essays and copy pasting it. It's in real time generating a new essay. Antipsychotics, also known as neuroleptics, are a class of medications that are primarily used to treat psychosis, a symptom of conditions such as schizophrenia, bipolar, and schizoaffective disorder. These medications work by altering the levels of certain chemicals in the brain, such as dopamine and serotonin, which can help reduce the symptoms such as hallucinations, delusions, disordered thinking. Schizophrenia, so blah, 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 blah. I won't read through all 1,500 words, but it's going to keep going until it hits 1,500 words. This is incredible. This has changed, essentially, what universities can test. My first impression from this is that the universities are right away from now are going to have to move towards a model of testing people in real time, doing essay exams where people have to write essays in real time. Just giving 1,000 students a take-home essay exam it can't be done anymore. All right, this is proving that as I'm talking, it's writing my essay for me. It's like, can't be done. There are limitations. This thing isn't perfect. There are some inaccuracies. It doesn't use references. But this is ChatGPT 3, right? And ChatGPT 4 is almost already ready. So it's going to come out probably in this year. So, things are moving really, really quick. And I know this is intimidating, right? Like, what does this mean for the future? People like Jordan Peterson very worried about it, and I think we need to have a very healthy level of concern about it. And I guess what I think is this is a tool that people are going to have to learn how to use to augment their capabilities to perform good work. And I can see a future where this is used to improve work as a tool, not as something that replaces people. I think it might replace jobs and people will have to learn new skills. But I think that's the most important thing thinking about the future is the key skill. Yuval Noah Harari, the historian and futurist, always says this as well. Like, hey, you cannot predict the future, but I can predict that the most important skill is adaptability. So, I don't think psychiatry as a job is going to be made redundant, but I think that what it looks like as a job will change significantly. So that leads into the professionals. How does this affect healthcare professionals working in mental health? We've spoken a bit about how it's going to affect the life of a student, and that's going to change how the essays are written. In terms of professionals like my job, it isn't quite at the level of a registrar intelligence, and it will be, right? You got to stay humble and realistic here. This thing will be smarter than me in terms of my job soon, and I'll be able to ask it for advice. But at the moment, the kind of advice it gives is still maybe like third or fourth year medical student level. So let me show you an example. Let's start a new chat, and I'm going to say I am a psychiatrist, even though I'm not, just to keep it simple. I have a patient that is 60-year-old male. He has chronic treatment-resistant schizophrenia. He has trialed olanzapine, quetiapine, but had to stop both due to side effects. He trialed aripiprazole, but it wasn't effective. He has now been on clozapine for, let's say, 20 years and has been stable. Unfortunately, in the past, I guess this does take a long time, but maybe one day it'll be voice to text, or they'll just, one day it'll just be audio recording your interviews with patients, and it'll just kind of recognize what you guys are talking about and give advice. Unfortunately, in the past, let's just say 7 days, he has had an emergence of his psychosis. So I'm a psychiatrist asking for advice. What should I do? He has no other medical conditions. He takes clozapine, let's just call it 200 milligrams, Nocte, and amlodipine, 5 milligrams, Mane. He lives at home alone, supported by the government. And I think you need to be really specific. What should I do next to treat his emergence of psychotic symptoms? All right, now let's go. Okay, increase the dosage of clozapine. As the patient has been stable on clozapine for 20 years, increasing the dosage may help alleviate the emergence of psychotic symptoms. Add an adjunct. Refer for ECT. Monitor for side effects. Regular follow-up. Consult with a specialist. Consideration of hospitalization. And it stops there. So, fantastic set of responses. Very good. I mean, it's missing some of the most important parts of this person's management plan, which is take bloods and look for a clozapine level? Like, what if this guy's just non-compliant? The most common reason for an emergence of psychotic symptoms, probably. So it kind of doesn't talk about some things, but look at this. This is so impressive. So increased dosage, that's very sound advice. If you have to look at clozapine level first. Add an adjunctive medicine, so that's absolutely correct. You could add aripiprazole with clozapine, see what happens there. ECT, very sensible. Side effects, I mean, this is all very sensible as well. The other thing I really like about ChatGPT is it says consult with a specialist, and values seeing it. Like it's always advising you to see a doctor, but it doesn't. I've done a couple of chats with this thing, and if you say I've got a headache and I'm dizzy or whatever, it doesn't just do what Google does, which is, this is cancer. You've got cancer. It could be something else, but it's probably cancer. So everyone freaks out, and people with hypochondriac will just stress and have panic attacks. This is way more sensible. It'll tell you to see a doctor, explore your symptoms, don't panic, rah, rah, rah. So it's help seeking, but in a non-panicky way. So this is an incredible tool. And then finally, how does this help patients? So this is going to change the game for patients. So if I'm a patient, this gives really good basic therapeutic advice. So I just tried out a couple of chats with this thing where I put in issues that patients have come to me with. I'm a 19-year-old male. I live at my sister's house with my mother. My sister is awful to me. She does not give me space and is always yelling at me. She smashes. I try to lock myself in my bedroom and she just keeps knocking at the door. It's stressing me out and I feel like I don't want to live. This isn't a real patient, by the way. I'm just making this up based on like a bunch of different people I've seen, and I'm just conglomerating it together into one story. So let's just see if it has any advice. Do you have any advice? I'm sorry to hear that you're going through a difficult situation with your sister. It sounds like you're feeling overwhelmed and stressed out by her behavior. Like, what a well-articulated, empathetic statement. One thing you could try is setting boundaries with your sister. Let her know that you need some space and that you would appreciate it if she gave you some privacy. You could also try talking to your mother about how you're feeling and ask her for support in addressing the situation with your sister. So that's really good. It's using the resources available, which is a third party, the mother. It's also important to take care of yourself and your mental health during this time. You can try practicing relaxation techniques such as deep breathing, yoga, or meditation. You might also benefit from talking to a therapist, a counselor about your feelings and experiences. It's important to seek help, yada, yada, yada. Here's some numbers. So it's giving resources to the client. That's great. Can you give me, I just want to see what happens, a 5-point action plan to address this situation with my sister. I'm just wondering if it has some like more kind of succinct advice. So step 1, set boundaries. Step 2, include mother. And guys, this is being generated in real time in GPUs that are being run. I mean, the GPUs are all owned by Microsoft. So this is, as a side note, this is Microsoft's big comeback to Google. Like, Google's been dominating the search engine history. They make, I don't know how, maybe 90% of their income just from ads on search engine. And now Microsoft, which has been sitting on the back burner for the last 10 years, or even 20 years, they've invested so heavily into like cloud computing, and all of this is being run on cloud computers. So I think Microsoft has invested a lot into OpenAI, which is the company that runs this. This is, by the way, a research project. So if you look at the bottom, this is a free research preview, and the goal is to make it more safe and natural to interact with them. This won't be free forever. ChatGPT, OpenAI as a company is spending $3 million per day running these computers that make this algorithm happen in real time. Yeah, so the other tips: focus on self-care, seek outside help, and be assertive. This is just fantastic advice. And the applications just keep going. I mean, this thing can summarize books into 10 points. It can write you emails. It can write code. I think the limitations of this tool is really the limitations of your imagination and your skills in being able to ask an artificial intelligence algorithm to answer a question, because you have to formulate questions a little bit differently, a little bit more specifically. And I'm no expert. So like at the end of the day, I don't understand how this thing works. Neural networks are incredibly complex. I have a general understanding at the surface level at best. So if you want to understand how it works, you should check out some more videos on YouTube about that. But I do understand that this is going to have a significant impact. I'm already trying to think about how to it affects my role. It's very good for writing up like patient education sheets. You can change the languages. It's a natural translator. It's a very good translator. The applications are just incredible. So keen to hear what your thoughts are. If you guys work in mental health or healthcare, how do you see this affecting your role or your patients' lives? I think this video could probably go for hours, so I'm just going to stop it there. I wish you all an absolutely lovely day, and leave some comments down below so we can start having a bit more of a dialogue. See you in the next video. Bye for now.